He's a board-certified anesthesiologist and addiction medicine specialist. He practices in Orange County and works with numerous rehab facilities and has worked with numerous facilities throughout all of Orange County. So addiction can come in many forms, right? Not just alcohol, not just drugs. What else are you seeing?
Yeah, well, I mean, addiction gambling use disorder. There are sex addictions. Increasingly, gaming is becoming an addiction. What we primarily treat by far and away are substance use disorders. That's the sort of more, that's the term that we use for addiction in the treatment community. So I'll use substance use disorder and addiction interchangeably. But yeah, we treat chemical substance dependency.
Okay. And so addiction changes brain chemistry, is that right?
Absolutely. I mean, that's part of the basis for what an addiction is. The brain chemistry changes, and as a result, behaviors change, and drugs are reinforcing, or that's the word for addictive, reinforcing, because they produce a lot of dopamine within certain parts of the brain, which is pleasurable or euphoric, and the brain begins to change in response to those high levels of dopamine by compensating. So what the brain does is it makes it harder and harder to produce that amount of dopamine. So what happens then is that it takes increasingly more and more of the drug of choice to produce the same level of effect. And then a secondary thing occurs in which that you develop tolerance, and withdrawal starts to become a factor. So when you take away this constant exposure to these substances, now you have a lack of dopamine in certain parts of your brain, and that's associated with dysphoria, being very uncomfortable. Certain drugs have intense physiologic manifestations of withdrawal, like opiate withdrawal is characterized as like heavy flu-like symptoms. These are all due to brain changes that are occurring like on the molecular level, and has to do with alterations in the neurotransmitters. And the primary one is dopamine.